I'm a geneticist, and I'm interested in how we can increase accessibility for genetic testing to high-risk populations. Genetics is commonly thought of as a pediatric field, so adults with intellectual disabilities are particularly underserved and disadvantaged and have a lot of healthcare disparities. This program was born out of an experience that I had working as a primary care doctor in a clinic for adults with developmental disabilities. And I was noticing how a genetic diagnosis could really aid in their medical care. A patient who has unknown lab abnormalities, maybe we could find a reason that this would be happening. My proposed program was to attempt to integrate genomic testing, so whole exome or whole genome-based sequencing, into a clinic for adults with developmental disabilities, a population at high risk for monogenic conditions, to see if we can change clinical outcomes. I have mainly been focused on genomic testing. It looks for spelling difference that can cause disease. We are entering an age of precision medicine where we're looking at people's DNA to help make recommendations about treatment or surveillance or disease management. People are very excited about genetic testing. Patients want it, their caregivers want it, providers want it, but it really remains inaccessible to a lot of the population. There are a few reasons for that. One is providers aren't well trained in genetic testing, both in ordering genetic testing, the financial implications of genetic testing, as well as interpreting results. And caregivers and adults with developmental disabilities have a hard time accessing genetics clinics. We went to a clinic for adults with developmental disabilities. We offered them genetic testing, so whole exome sequencing. And then we measured by survey what their attitudes were towards genetics, and then whether they wanted to undergo the genetic testing. Using that data, we were able to measure uptake rate, so the number of patients or their caregivers who were interested in proceeding with genetic testing, and then we measured diagnosis rate, the number of people that had genetic testing that ended up with a new genetic diagnosis. The uptake rate is 100%. Everyone that we've recruited is interested in genetic testing. They all believe that genetic testing is very important. They're not worried about how the results will affect their health. They just think that they could improve their health. But we're still waiting for some of these test results to come back. So I'm hoping that we'll be able to scale it to a multi-center trial because I feel like this work is really important. So I'd love to see kind of a regionally based genetic counselor who could work with these clinics and help them order the test, so bypassing that long wait list to see geneticists, and then make sure that patients are getting adequately counseled, making sure that the financial concerns are taken care of, and then getting patients that need to see genetics into genetics. This has implications for the genetics community and implications for like the larger community of just high-risk adults and how we can really help manage their care in the future. To see how a genetic diagnosis can affect the healthcare for a person who is at risk for significant healthcare disparities has really renewed my interest in making sure that we're seeking diagnoses for these folks.